And I think we all assume that that hospital is going to be there when we need it. But what we are seeing from the latest financial data that we have just released is that having that hospital in your community is not a guarantee.
A new report from the Hospital Association of Oregon shows nearly half of hospitals in the state are regularly losing money. And the warning from industry leaders is stark. Without change, we could see service cuts, staff layoffs, and even hospital closures.
A little over 2/3 are not able to do the kinds of things that patients expect, like replacing their equipment in a timely manner. That's a really troubling sign.
The president of the Hospital Association, Becky Haltberg, says this crisis is not just about balance sheets. It's about access to care for people across the state. According to the report, hospitals in Oregon have been hit by a triple threat: rising costs, workforce shortages, and reimbursement rates from government insurance programs like Medicaid and Medicare that don't cover the full cost of care.
So hospitals need payments that cover cost in order to be stable. Medicare only pays about 82 cents on the dollar. That's the program administered by the federal government. The state-administered Medicaid program only pays about 56 cents on the dollar. And so for every Medicaid patient, the hospital is essentially paying $1 in cost and only getting back 56 cents. So if we want to have viable, strong hospitals in Oregon, we have to address this imbalance.
That's especially significant in a state where roughly 30% of hospital patients are on Medicaid and another 16% on Medicare. Now, at the same time, hospitals are dealing with higher labor costs, expensive supply chains, and uncertainty over tariffs on medical supplies.
The essential math equation is that your revenues have to equal your expenses. And for too many hospitals, their expenses have grown and their revenue has not kept pace. So that is really the fundamental math equation. That's the problem here. That's exacerbated by policy choices that the state has made, which have affected hospitals' ability to operate efficiently, and the inability to discharge patients whenever they're done with their hospital stay into the community. So it's really kind of a perfect storm of factors that has created this crisis.
Haltberg says the signs of strain are already showing up, not just from the standpoint of hospital finances, but difficulty finding and receiving care in the first place.
Well, I think we're already seeing signs of a system in crisis. If you go to the emergency department, it might be a really long wait to see someone. We hear about people all the time who have a hard time finding a primary care doctor. We also hear about people who wait months to see a specialist or who even are traveling outside the state for care. Those things should concern us all because they are signs of a system that's not healthy. They are signs of a system that is not able to meet patients' needs like we would like it to.
Some hospital systems have looked for financial stability through mergers. We saw it right here in Portland with the proposed OHSU and Legacy merger that ultimately fell apart earlier this year.
Well, in general, you're seeing hospitals respond to this financial crisis in many different ways. Some hospitals are cutting staff, some hospitals are cutting services for patients, and some hospitals are seeking mergers or partnerships or affiliations to help keep them afloat. So the OHSU Legacy merger was one such affiliation. There are others going on in the state right now where hospitals are just saying it is too hard for me as a smaller organization to survive, so I need a partner to help me.
Okay, so what happens next? What can be done? Well, Haltberg says without help from lawmakers at the state and federal levels, particularly around Medicaid reimbursement and workforce support, the cuts will keep coming.
I expect that there will be more layoffs. I expect that there will be more service closures. I hope we don't have a hospital closure. I think it's not out of the realm of possibility, but I think in the near term, we will absolutely see more layoffs and more service reductions.